So I'd like to kick off our conversation and maybe ask you both if you remember the day, the moment, the memory of what made you realize that you really wanted to become a nurse. Kristen, do you want to go first?
Yeah, sure. I couldn't tell you really because as long as I can remember, I have always wanted to be a nurse. It really is the only thing I ever wanted to do. My grandmother, who I adored, was a nurse, and one of my aunts, my Aunt Amy, was a nurse, and I really looked up to her. So I just knew from my earliest memory that that's what I was going to do.
April, how about
I
you?
can I can echo so many similarities to Kristen, and you'll hear that throughout our talk today, where there's a lot of commonalities. There wasn't a day that I realized I wanted to be a nurse. I was born a nurse. I always say nursing found me. My grandmother also was a nurse. I didn't know her. She was had come through this earth before I did, but I know that she was a nurse. And it was just what I wanted to do always. And so, with that said, I saw the goals ahead of me like a roadmap to the future. I could see them like stars in the sky, and I would just grab one to grab the other. I was a nursing assistant before I graduated high school, and then I was an LPN, and then an RN, and so on and so on, and have really dedicated my whole life to being a healer to myself and to others. And nothing um, fills me deeper than to be a nurse and to be able to provide for others around the world, all people, all walks of life.
So April, I loved what you said. It's being a healer, and I'm wondering if I can push both of you further. What about being a nurse do you think echoed part of who you were? Kristen, what was it that was that attractive thing to you?
I just know that I have always been like a helper. I've always, since I was small, like will jump in to help somebody who needs something, whether it's a small thing or a big thing. When I was a teenager, one of our friends was having trouble in the water, and I dove in, even though I'm not a real strong swimmer. I just dove right in to help them, even though everyone else was still sitting in the boat. If there's an accident, I would pull the car over and help. Like it just has always been a part of who I am. So it was really a natural thing for me, to choose that as a career too, to be that helper.
I think, again, similarly, my brother is a battalion chief for a fire department in our local community. My mother was a paraplegic. She did not need our help, but I desperately wanted to help my mom. From the very beginning of my memories as a very small girl, I really wanted to help her. She was fiercely independent. But my brother and I have also something very in common. And like Kristen was saying, there's people that walk into the fires when everyone else is running out. And I see that as a firefighter and my brother and me as a nurse, we were just born into a family where we wanted to run into the fire and be there for someone's um, most significant, impactful, hard, scary, vulnerable time in their lives. It's just something that's in us that we want to be there for that and hold their hand through that, whatever that may look like.
I mean, I like the analogy of the fire because it seems like it's very obvious, but I feel what I hear both of you saying is that you also notice where there is a need. And I think sometimes others are quite slow to notice the need, but you see it right up front and ready to jump in, which is very special. Uh, Today we're speaking about substance use and diversion among nurses. And Kristen, I'd like to give you the chance to read a little extract from the memoir that you wrote based on your own experience in the book called An Unlikely Addict, One Nurse's Journey Through Addiction. Would you mind reading that piece for us?
Certainly. This was where she crossed the line. If she had just stopped there, if she had just realized what taking that morphine would lead to, if she had realized that once she tried it, there would be no turning back, if she had realized the pain it would cause. But she didn't even consider any of that. She didn't consider the fact that she was stealing, cheating. If she had thought about it, she wouldn't have had the courage to do it. So she didn't think about it. She just put the morphine in her pocket, along with a syringe, smaller needle this time, and excited, went home.
Kristen, so this was kind of in the middle of your story. What led up to this point, and what came after that point? If you could maybe give us a brief understanding of that.
Yeah. Well, certainly my substance use did not start with morphine IV. My substance use started really back in college. I went away to school all the way to Winona, Minnesota, which really isn't that far. But when I was, a youngster, it seemed like a world away. I went away to school. I had a ton of anxiety, although I didn't know that's what it was. And like many young college age kids, I went out one night with my friends and drank quite a bit and really had no experience with drinking, or at least very little. What I found when I drank was that I felt wonderful. I felt like I fit in. All of the that discomfort I had, all of that went away, and I thought I was funny and pretty, and I just felt like a new person. And after that, I thought I need more of that. Like that is my answer to all of my issues, alcohol. So I found myself drinking quite a bit, more so than my peers. Enough so that it took me 6 years to get my 4 year nursing degree. I had my first daughter while I was in college. I did not make good choices when I was drinking and ended up pregnant. But really, that was kind of the thing that saved me and got me through the rest of school. I was able to clean up my act, so to speak, for her, and did that and graduated. I moved back home here in Milwaukee, Wisconsin, and things were okay those first few years after graduation. My daughter and I, uh, I went to work at a local pediatric unit, fell in love with pediatrics, and my daughter and I really had a nice little life. I drank sometimes, but I was a binge drinker, so maybe a handful of times a month I drank, always at night after my daughter went to bed. I didn't go out very often with my friends. And so I had myself convinced that I was being a good mom. Like I did not see any issues with what I was doing, even though I drank like till I passed out and was miserable for the next day or two. So things, went along that way for a few years. And then later in the 90s, I started dating my first husband, and he drank a lot. I didn't really date people who didn't drink like I did, and ended up marrying him, even though he was not a very nice person when he drank. Uh, that same year that I started dating him, I had surgery, a minor surgical procedure, but I was prescribed Percocet after the procedure. I loved that Percocet. From the first time I took that, I thought, this is great. The reason I liked it is because I got the same relief from it than I did from alcohol, like that same, that makes me feel better. But I didn't have all the side effects of alcohol. I didn't stumble around or act stupid or smell bad, and I didn't have hangovers. So that was very appealing, as you can imagine. As I'm being an adult and trying to have a successful life, it was easier to maintain that with pills. So I found reasons to get more pills the next few years, maybe a handful of times, nothing outrageous, but still was deceitful getting them. I would fake back pain to go to my doctor's office and get some. My first husband was a carpenter and he'd hurt himself. He'd go to the ER and they'd always give him opioids, no matter what the issue was. He'd share them with me. I did that kind of thing. And then around the year 2000, I was working in a pediatric emergency room. And we wasted a lot of controlled substances in that ER because our patients were little and the doses that our medications came in were large. So we were supposed to waste a lot of it. And one day I had the leftover, that morphine in my hand, and I didn't really think about it. I just put it in my pocket. And, with kind of the realization like, wow, we throw away a lot of really good drugs. And I just slipped it into my pocket. I took it when I got home. And I had that same kind of reaction like, oh my gosh, is that awesome? Like, not only did it make me feel better, but it was immediate. And that was really appealing. My life was really hard. My husband wasn't too nice. Work was stressful. So that made it better. Then fast forward a couple of years, I probably did that kind of behavior for 3 years or so, taking really every wasted medication I had instead of throwing it away, taking it. Um, One day I had leftover fentanyl, and I had the same kind of reaction the first time I took that fentanyl of like, holy cow, that makes me feel better. Uh, that fentanyl, if you aren't familiar with it, is a very strong opioid. Uh, the effect it had on me was immediate. I craved more instantly. Before, if I didn't get any wasted medication in my shift, I would go home. Kind of bummed out that I didn't have anything, but I would go home. Once I had that fentanyl, I had to have something every time I was on shift. There was no more, well, maybe I'll get some, maybe I won't. It was like, I have to have it. If I didn't get anything from, a procedure left over from a procedure, I started stealing fentanyl from stock. It doesn't take them long to figure out what's going on when you do that. So I was confronted when I came into work one night, and my manager met me at the door, walked me into a conference room, and sitting in the corner was a sheriff's deputy with a big gun on his belt. There was a detective that led this interrogation. The director of pharmacy, the director of security, the director of HR, the chief nursing officer, like all these people were in this room. And that detective confronted me with all the evidence they had that I had been diverting substances. And I denied everything. I was really, as I look back on it now, I was just in a state of shock and panic. I had no idea how or what to say or what to do. I was just flabbergasted. My manager, who was there too, told me later that I looked very calm, like it was no big deal, but inside, like I was just in a panic. So I denied everything, and they suspended me, and security walked me out of the hospital. I ended up losing that job. I got fired. I lost my nursing license. I was charged with like 26 felonies. Ended up spending 4 months incarcerated. So it was that incarceration where I said, I did not like jail. It was not fun. I don't recommend it, except for the fact that that was the thing I needed to wake me up and say to myself, I do not want this life anymore. I I don't like it. I don't want it. And so once I got out of jail, I really threw myself into recovery. And, I spent the last 20 years now kind of rebuilding my life into something I can be proud of and that, I want it to be.
Thank you very much for sharing that. Yeah, it's very brave and special to hear you share your journey so openly. Thank you.
Thank you.
April, you've had your own experience with substance use as well, and are there any common threads with Kristen's story?
Yes, absolutely. Although our stories are very similar and very different all at once, I'll share my background and where I see some common threads between Kristen's story and mine, even though they're the same but very different. My story starts as a very young girl, 12 years old, when I was introduced to alcohol from a neighbor. And from the second it touched my lips, I had an alcohol use disorder. I didn't even know it. I had to spend the next 30 years drinking to find out that I had a progressive alcohol use disorder, similarly to Kristen. Mine wasn't pills or IV fentanyl, and it was not licensure problems, and it was not being arrested or having to spend any time in prison. Mine was just alcohol use, and mine stayed with me, like I said, for that 30 years of problem drinking. And it progressed over time until I hit a very spiritual, emotional, and physical rock bottom. And so, backing up a little bit, throughout that 30 years, I want to talk a little bit. I don't want to talk about all that time I spent drinking. I want to pinpoint the time where I was an ICU nurse. I was a critical care nurse, and I was at the top of my game, and I was in that ICU, and it was my passion and my pride and really what I wanted to do and where I wanted to be. And I cared for patients and families with my whole heart. And I didn't know how to cope with my deep emotions that I was swimming in since I was the age of 12. And I didn't know how to not carry other people's pain. So when I had hurting patients and families in that ICU, I shared that with them. And there's a culture, or there was for me in a critical care setting, where there is so much pressure, high burn, high intensity, high turnaround. I had to impress not only my patients and families, but my colleagues, my nurse managers, physicians, and others that were around me. It was a very intense environment, and I would go home after my shifts, and the only thing that I knew to do was to drink and to numb my pain, to try to figure out how to feel better. And similarly to Kristen, I didn't think about it. It really wasn't something I sat around going, I wonder if I should drink tonight. I wonder what the consequences of drinking tonight would do to me. It was so incorporated into who I was as a person and as a nurse that that's what I did to get through. And that's what I did to be able to go back and face what I had to face in that ICU. And so what ended up happening is, like Kristen, I was turning 40. I was about reaching 30 years of problem drinking. And that rock bottom that I talk about after a progression of intensifying alcohol use throughout those years really came to a halt. And I was fortunate enough to have my mother introduce to me that maybe, just maybe, my drinking was the cause of a lot of my problems. And just that small suggestion made me realize, okay, she knows I'm at bottom. I think I need some help. And I opened my heart to a spiritual awakening, and I found myself to the rooms of Alcoholics Anonymous. But more importantly, and what we're going to talk most about today, is in conjunction with that, I found a nurse, a very strong nurse that was the founder of the Minnesota Nursing Peer Support Network, that was standing up in front of other successful nurses and saying that she had a problem with alcohol. And because she did that, and she said that she also had a problem with alcohol, and she talked about the pathway to recovery, I was able to get on that path with her. And here I am 8 years later in recovery.